Hey, how are you?
I'm fine, how are you?
I'm good, I'm fine as well. Hey, buddy, how are you?
I'm a fan.
I'm fine.
I'm fine.
How are you? I bet the phrase, I am fine, is one of the first things you learn when you study English.
Fine.
Fine, good. But saying it right after you leave the hospital is expensive. People know this because everybody gets sick. Hey, Siri, how are you?
Hey, I can't complain.
Ooh, I can't complain. Well, yeah, of course you can't complain. You're just software.
Medicare reform bill is on its way to the president's desk after the House and Senate gave final approval in a...
Right now, in my home country, American politicians are arguing over what is the best medical insurance. And it goes nowhere, even though there's dire need for reform. How the government will regulate and disseminate medical insurance is one of the biggest concerns among Americans. Because right now, most can't afford it. So how does China make it possible for 1.4 billion citizens to get health coverage? Let's go find out.
Healthcare system is a very complicated system.
That is an important issue that all governments are struggling with.
With a population of 1.4 billion, Chinese hospitals treat about 8 billion patients per year. To tackle the global challenge posed by medical insurance, China firmly believes that an all-around moderately prosperous society cannot be achieved without the people's all-around health. Public health should be given priority in the country's development strategy.
We understand that this is a human right, that people have the right to be healthy.
In China, the healthcare system is rebuilt, especially for the rural area. All the people are covered by the basic health insurance. China created a very unique primary care system.
In China, it's marvelous that I don't have to buy a cup of coffee before being allowed to use the washroom. Not only in the big cities, but in the countryside as well. In the small villages, there are well-equipped washrooms prepared for everyone. In the larger areas of the countryside, they're upgrading the washroom system. Like China's basic medical insurance system, that covers everybody. These small but beautiful conveniences are available. And the best part, it's free. For me, the most convenient thing is that you don't have to feel embarrassed when you're in a hurry. Excuse me. Thank you.
Toilets are a key indicator in measuring the advancement of a country, and their improvement will directly affect public health. In China, a toilet revolution is sweeping across the country. In 1993, the first Rural Environment Health Investigation revealed that only 7.5% of the rural areas in China have toilets. By the end of 2016, the figure had gone up to 80.3%, and China's target is to reach 85% by 2020. The introduction of the toilet revolution harmlessly processes excrement, which effectively kills bacteria and parasites in the excrement, and reduces the breeding of flies and mosquitoes. The oral fecal route transmission incidence rate in project areas has thus dropped significantly, from 37.5 to 22.2 per 100,000 people, among which the percentage of dysentery, typhoid fever, and hepatitis A patients dropped by 35.2%, 25.1%, and 37.3%. Consequently, epidemic-prone diseases are prevented and controlled right from the start, and the overall medical expenses reduced. Like the universal medical insurance, the measure improves the health condition of the Chinese people and prevents the occurrence of diseases. The basic medical insurance system of China is the largest in the world. In addition to covering the employed urban population, it takes care of the urban unemployed and rural population, effectively safeguarding the health of the Chinese people. In 2017, the average life expectancy of the Chinese people reached 76.4%, rising to 40th place globally to becoming one of the fastest ascending countries. The Lancet, an internationally renowned medical journal, has ranked China among the top 5 countries in the world with the greatest medical advancement, which tributes largely to the country's medical reform.
Basically, we have 2 insurance, workers' insurance and the residence insurance. Workers' insurance is mainly paid by the employer, and the residence insurance are mainly paid by the government. Right now, the target is we were trying to achieve is let individuals out-pocket payment less than 30%.
Almost all governments then ask their population to cover a part of the costs that they, out of their own pocket. WHO suggests a standard that cost sharing should not exceed 20%.
Despite the rising health spending as a share of GDP in China and the falling personal health spending in the total health expenditure each year, China still lags behind. Compared to the US in 2017, China's total health expenditure amounted to 6.2% of its GDP and about $560 per capita, whereas that of the US amounted to 16.2% of its GDP and about $9,500 per capita. China's health spending per capita equates to only about 1/17 to 1/18 that of the US. Globally, in 2014, the average world health spending as a share of GDP already reached 9.9%, whereas China has yet to reach this figure even today. In 2018, the Lancet's Healthcare Access and Quality Index ranked China 48th in the world, rising 13 places from the previous year. But the country must continue its hard work.
On the one hand, China ranks 48. On the other hand, if you look at the band in which China is sitting for its level of health expenditure, it is among the highest. In one of the graphs, it's even the highest achiever with the highest performance.
I think Chinese healthcare system still have a lot of problem to fix. Given such huge population, now people their living standard is increasing. They want a much better, high quality healthcare.
The film generated heated debate in China. It tells a story of a small pharmacy owner traveling alone to India to buy cheap pirated drugs to help leukemia patients who can't afford the patented drugs. In China, certain drugs for major and serious diseases are rather pricey, which often drives patients and their families into poverty. Statistics show that the 5-year survival rate of cancer patients in China is about 30%, whereas in developed countries in Europe and the United States, the rate is between 70 to 80%. Apart from the innovative medicine's swift development and the advanced medical technology in these countries, another key reason is the affordability of cancer drugs. The costly medical expenses are a challenge demanding urgent solutions in China.
In China, the main healthcare delivery institutions are public hospitals, but the government funding count less than 10%. So many of their operation money they need to earn from the market. On the other side, the cost is rising rapidly is because we have this universal coverage. That's why the healthcare reform need to keep going on. Yeah, we only finished the first step.
Step by step, China must continue to intensify its medical insurance reform to tackle the issues it's facing. From May 1st, 2018, most of the imported drugs, particularly anti-cancer drugs, have become tariff-free in China, which will reduce the prices of anti-cancer drugs by up to 20%. On October 10, 2018, the medical insurance began to cover 17 additional anti-cancer drugs. The newly negotiated drug prices are on average more than 50% lower, and the payment rates for most imported drugs after negotiation are lower than the market prices in surrounding countries or regions. The Chinese government aims to provide comprehensive lifelong health care for 1.4 billion people, so they may all receive equal medical services.
Inside larger hospitals, in cities like Beijing and Shanghai, you will see many people from every part of China. They come with their luggage and family, flooding the best hospitals. In the halls of these hospitals, people wait in long lines and even take up temporary residence, longing for medical treatment. The doctors are very busy, so that they don't even have time to smile. A hospital is one of the craziest places in China. God. Oh, again, can you help me? I'm in a lot of pain here. Help me get to the hospital.
No. 不用去这儿，去社区医院就行。
Really? Clinic?
In China, community hospitals see few visitors because people only trust famous doctors from large hospitals in big cities. The situation is rather widespread. Union Medical College Hospital is one of the best hospitals in China. With so many outstanding medical staff working here, the hospital once received over 10,000 patients in a day. In China, hospitals like Union Medical College Hospital, providing high-standard medical care and treatment in and around the area they are based, account for only 7.7% of the total hospitals in China, but they receive 48.7% of the patients from across the country.
Indeed, if I were to put my own wish list for the next 10 years, it would include a specific attention to the disparities that exist between provinces.
But our research is finding out, in China, the income disparity is much higher than the health disparity, because in the past years, government heavily invested the health, all those resources moved to the western, to those underdeveloped areas. It's improved the health status. I think this is a good sign.
If we want universal health coverage, we must be providing high quality, trustworthy primary care services with more community level professionals that are able to deal with most problems of China's health. Screening for early signs of cancer, general behavioral advice in order to reduce risk. These are all at primary care level, and they can reduce a lot the need for hospital level care.
So now we try to integrate all the systems from public health, health maintenance, primary care, tertiary hospital combined together. We take the responsibility for the people's health.
2019 marks the 10th anniversary of a new round of intensified health and medical care reform. Over the past decade, China has achieved universal medical insurance coverage. But from a long-term perspective, China should pursue higher-level public medical insurance, so not only can the people afford treatment for minor complaints, but also for major diseases. Moreover, they should all enjoy equal medical resources of high quality. More than that, China will ensure the delivery of comprehensive life cycle health services for people. In China, it is known as the Healthy China Strategy.
We should be proud of what is being done because, come on, 1.4 billion people is not an easy number to work with.
Healthy China is not only, we need to provide the universal coverage for the people to get the treatment of diseases. I think China contribute to the world is we can find a new way for the health, not only for disease care, because health is the goal.
Let's do this. You hear that music? On the sidewalks and in the squares, there are people dancing. You will see them dancing. They call it square dancing in China because it usually happens in the square. You know, with the growing number of elderly, it is even more important to have better medical insurance. Only with that can they continue to dance happily. How are you? Yes.